Local police continue to investigate drug diversion claims at Asante Rogue Regional Medical Center in Medford. MPD says that Asante contacted them, saying that they believed a former employee was involved in the theft of a controlled substance meant for patients. We have team coverage tonight, continuing our dive into the claims and the investigation. We're joined live by Newswatch and Damien Alvarado. Here in a few minutes, McKenna will be sharing details about articles posted by Asante after waterborne bacteria. But first, let's head over to Damien. Damien, I know you talked to a local law firm about this investigation. What were they able to tell you today?
Medford attorney Tom Peterson shared with me today that a lot of people have been calling, trying to seek legal counsel, and he confirmed with me that other law firms have been receiving the same messages. And he was also able to tell me that there have been no lawsuits filed yet at his law firm, but they are, continuing to offer that advice. Medford Police Department said they have been investigating claims of drug diversion at Asante Rogue Regional Medical Center since early December. In our interview with Medford attorney Tom Peterson, he said several people have called regarding the matter. The firm is conducting independent of law enforcement or state health authorities in its investigation, and they're drawing information where possible from external agencies. Now, the Oregon Health Authority told Newswatch 12 that they are investigating incidents at Asante in Medford involving a nurse allegedly to have tampered with pharmaceutical fentanyl used to treat severe pain and induced tap water in patients' intravenous lines. Here is what Peterson said Asante could be held liable for.
Asante knew or should have known that there was a problem with the water and that the water was connected to a switch in medications, or they didn't keep a good med count of where the fentanyl was going, assuming it was only fentanyl, then there would be a claim for negligence.
Regarding legal action, Peterson said there could be potential claims against the nurse for misconduct and discussed the employer responsible for the actions of its employees. He also said claims of negligence can be made if Oregon Health Authority and Medford Police investigation of incidents find them liable. And Newswatch 12 will continue to search for more information on this developing story, and we'll be sure to report that back to the public as soon as we find out more. Reporting live in Medford, Damien Alvarado, Newswatch 12.
Damien, thank you. And the drug diversion claims at Asante allege that a former employee used tap water to replace fentanyl prescribed to patients. Now we're learning that bacteria was found in Asante's water supply back in 2022. Newswatch 12's McKenna Marks did some digging for us today, and she's joining us live in studio. McKenna, what can you tell us?
Well, Haley, that's right. I did some digging today and found two articles posted on Asante's website. It looks like Asante found evidence of waterborne bacteria from September to December of 2022. In a post from March of 2023, Asante said these infections were associated with the skin, the gut, and those more associated in the environment. Asante also noted that these kinds of infections aren't unique to hospitals. Medford residents are supplied with the same water in their homes. While these kinds of infections aren't typically harmful, Asante says they posed a risk to the hospital's most vulnerable patients. In that March 2023 post by Asante's Vice President of Quality and Patient Safety, it says, quote, "Bacteria can be common in any water supply and may be harmful when used for patient care of our vulnerable patients. That's one reason why we check our water source regularly and have precautions in place to prevent waterborne infections." I reached out to Asante today for an update on the safety of their water supply, but was told Asante had no comment at this time. Reporting live in studio, I'm McKenna Marks, Newswatch 12.